All right, so get this. Imagine imagine a world where your doctor has this secret weapon,
Okay.
like a superpowered sidekick, right?
Yeah.
Helping them diagnose those like really tricky diseases,
Hmm.
personalize your treatments, maybe even lend a hand during surgery.
Wow.
Sounds kind of sci-fi, right?
It does, but it's not sci-fi.
Really?
This is the reality of AI in healthcare, and it's happening right now.
That's what's so fascinating about this chapter you sent me from Beyond the Hype. The realities of AI in clinical practice.
Yeah.
We're really diving deep into how doctors are navigating this whole new world. And trust me, it's way more complicated.
Oh, absolutely.
And way more interesting than just robots taking over the operating room.
Exactly. And this chapter does such a good job of laying out both the incredible opportunities and the very real challenges that doctors are facing
For sure.
as they try to integrate AI into something as complex and human as healthcare.
Okay, so let's break this down.
Okay.
One of the first things that really jumped out at me was this idea of a learning curve.
Yeah.
Not just for the doctors, but like for patients too. I
Right.
mean, think about it. How many times have you gone to the doctor and you're like, is this technology from the Stone Age?
Right. Right.
It feels a little outdated.
It's a valid point, and the chapter actually quotes the Shadow Health Secretary
Yeah.
from a 2023 article.
Okay.
And they basically called the NHS's current technology creaking and outdated,
Ouch.
which it's kind of true.
Yeah.
And when you think about it, alongside the advancements in AI we're seeing.
Yeah. It makes you wonder, like, how prepared our healthcare systems really are for this kind of technological leap.
It's true.
You know what I mean?
It's like handing someone a smartphone who's only ever used a rotary phone.
Exactly.
Right.
Yes.
And it's not even about the technology itself, right?
Right.
It's about making sure doctors feel comfortable and confident using it.
Absolutely.
The chapter mentions a study from 2024
Okay.
where over 70% of clinicians said they learned about AI in healthcare passively,
Oh, wow.
not through formal training.
That's concerning.
Yeah.
Because, I mean, you wouldn't want a surgeon operating on you with a tool they'd only heard rumors about. You know what I mean?
That's terrifying.
And as a patient, you should be concerned about whether your doctor is equipped to use AI effectively.
It's about trust, right? It is. Absolutely.
Trusting that the people who are caring for us have the knowledge and training to use these powerful new tools safely and ethically.
Absolutely. 100%. And speaking of trust,
Yeah.
one of the biggest challenges this chapter highlights is this whole thing with AI bias.
Oh, right.
So, for example, it talks about this computer program that was designed to, help diagnose skin cancer,
Okay.
but it was trained mostly on images of light-skinned patients.
So wait, what happens then? Does it just not work as well for people with darker skin?
That's exactly the problem.
Oh, man.
And it's a huge concern
Yeah.
because it gets to the heart of how we train these AI systems.
Right.
If the data we use to train the AI is incomplete or skewed,
Right.
then the AI's decisions will reflect those biases. And that could lead to, misdiagnoses or inadequate care.
And that's scary because in a field like healthcare, the stakes are so high.
Huge stakes.
It's not just like, oh, the AI got my music playlist wrong.
Right.
This is big stuff.
It's life and death sometimes.
It makes it feel a lot less abstract and a lot more real for, the average person.
You're right. It's not some theoretical debate anymore.
Right.
These are real-world issues with real-world consequences
Yeah.
for patients.
Absolutely. And that brings us to another big question.
Okay, shoot.
If an AI makes a mistake, like, who is liable? Is it the doctor, the hospital, the company that created the AI?
That's the million-dollar question, isn't it?
It feels like a big one.
And as the chapter points out, there's no easy answer. In Europe, for instance, there's still no clear, legal framework for figuring out liability.
So it's like the Wild West out there.
Kind of, yeah.
Wow.
It's a little unsettling.
It is.
Not just for, doctors and hospitals, but patients, too, right?
Of course.
Because it raises questions about accountability, about transparency, and ultimately, trust.
Speaking of trust, I was really fascinated by that graphic in the chapter that shows how the whole dynamic between, doctors, patients, and technology is changing.
Oh, yeah. Yeah. It's this really simple but powerful image. It starts this very, straightforward two-way street
Right.
between, doctor and patient.
Yeah, classic.
Yeah, which has been the case for, forever, right?
Yeah.
And then the internet comes along, and suddenly it's a triangle, right?
It's true. It's true.
Patients are,
Googling their symptoms.
Googling their symptoms. They're, looking up, WebMD and all this stuff.
Yeah, researching treatment options.
Right. They're basically becoming more active participants in their own healthcare, which makes sense
Yeah, which makes total sense.
because we have access to so much information now.
It's only natural
Right.
to want to be more informed.
Of course.
Right.
You're not
Exactly.
just going to blindly trust.
Right. And so now
everything.
you throw AI into the mix,
Right.
and it's adding this whole other layer to this dynamic.
Right.
The chapter talks about how AI could lead to, like, this four-way relationship
Oh, wow.
with patients potentially interacting directly with, like, AI-powered diagnostic tools,
Oh, wow.
treatment recommendation engines.
Wow, okay. Even virtual health assistants.
Okay, I see where this is going. It's
Yeah.
like more information is good.
Right.
But then it also kind of begs the question of, like,
Right.
who do you trust,
Exactly.
your doctor or, like, the algorithm?
The algorithm, yeah. And the chapter quotes a study participant who said, patients may end up feeling like, if the AI can tell me that, then why did I even bother coming to see you?
Wow.
Like, that's kind of a gut punch,
It
right?
is.
It really highlights the potential impact
Yeah,
this technology could have on the doctor-patient relationship,
absolutely.
which we don't want to get rid of,
No,
but we want to redefine it,
totally.
right?
Yeah.
And that requires these open and honest conversations about how AI can be used to enhance, not hinder,
Right.
the human connection in healthcare.
Totally. It's about empowering the relationship, not replacing it.
Yes, exactly.
Right.
Yeah.
But let's be real, AI isn't just changing things for the patient, right? It's totally transforming healthcare for the people on the front lines, the doctors.
Absolutely. And one of the biggest impacts, I think, is the sheer volume of information that AI can process and analyze.
Right.
And so this chapter talks about how AI can help doctors, for instance, diagnose those really rare diseases much earlier than they ever could before.
Okay.
Just because it can look at, like, mountains of data
Oh, wow.
and spot patterns that, we as humans might miss.
Okay, so it's almost like having this, like, super-powered detective working alongside the doctor, helping them piece together these clues and crack the case.
Exactly. And it's not just diagnosis.
Mm.
AI is also being used to personalize treatment.
Oh, wow.
So tailoring them to each individual patient's needs and characteristics.
So it's like, instead of this one-size-fits-all,
Yeah.
it's more like a precision medicine.
Precision medicine, yes.
Using AI to figure out the absolute best treatment for you.
Yes. And the chapter gives a great example of how this is already happening in, like, rehabilitation medicine.
Okay.
So AI is being used to analyze data from wearable sensors, for example,
Okay.
and all these other sources to create these hyper-personalized rehab plans
Wow.
to optimize outcomes for people who are, recovering from injuries or illnesses.
I'm not going to lie, as someone who has spent way too much time in physical therapy, I love the idea of AI, like, speeding up my recovery.
Right. It's amazing. And beyond the patient-facing applications,
Yeah.
AI also has the potential to improve the lives of the clinicians themselves.
Oh, interesting. Okay.
So this chapter talks about how AI can reduce, all those pesky administrative burdens,
Really?
which frees up doctors to spend more time with their patients.
Because I always thought new technology just meant more work for doctors.
Right. It can feel that way,
Yeah.
which is why this chapter stresses how important it is to involve clinicians in every single step of the AI development and implementation process.
Wow, that's huge.
Right? Because if the technology is not designed with their needs in mind,
Right.
it's not going to be helpful.
It's not going to work.
Right.
It makes total sense.
It's like, the tools have to be designed for the people who are actually going to use them.
Yeah. Okay, I like that.
So going back to this idea of AI easing the workload, why is that so important?
Right.
Because what happens when doctors are bogged down with paperwork and administrative tasks?
Right. They get burnt out.
They burn out.
Right.
They have less time for their patients,
Right.
less energy, and that leads to, worse patient outcomes.
So in a way, AI has the potential to not just improve the efficiency of healthcare, but also the humanity of it.
Yes, exactly.
Which I love.
Yes. And speaking of amazing things,
Yeah.
this chapter touches on this almost futuristic concept called quantum AI, QAI.
Okay, I had to Google, like, quantum physics to, like, refresh my brain on what that even means.
It's very next level stuff.
Just a lot.
But basically, think of QAI as having the potential to supercharge everything we've been talking about: drug discovery, medical imaging, personalized medicine. QAI can potentially make it all happen exponentially faster and more precisely.
So is this, like, decades away or?
It's hard to say.
Oh.
It's hard to say.
Okay.
It's definitely still early days for QAI.
Right.
But to think that that could be, like, the future of healthcare is kind of amazing.
Mine's exciting.
It is exciting. It is.
Okay.
So while the future of that might be a little bit of a mystery,
Yeah.
this chapter does such a good job of, like, breaking down how AI is impacting, like, the day-to-day reality of being a doctor right now.
Right.
And one area where this is really clear is how AI could change the way doctors apply medical knowledge.
Okay. I'm interested.
So the chapter brings up this framework from the Medical Schools Council, which talks about, like, the threefold role of a doctor, which is applying medical knowledge, supervising care plans, and then conducting education and research.
Got it. Okay.
So how does AI fit into all of that?
Right.
Well, the chapter argues that AI could fundamentally change each of these areas.
Wow. Okay.
So imagine a world where during a consultation, you're talking to your doctor.
Right.
They have access to, like, real-time AI-powered tools
Right.
that can analyze your medical history, flag any potential risk factors,
Wow.
even suggest possible diagnoses based on your symptoms.
It's like having an incredibly knowledgeable, always-on consultant, like, right there in the room with you.
Yes.
That's amazing.
It's like having, another doctor in the room.
Right.
Right. And this could be, like, game-changing, especially for complex cases.
For sure.
Or if a doctor is just stumped. They're like, I don't know what's going on.
I need a second opinion.
Let me just run this through the AI.
Yeah, exactly.
So it's not about replacing the doctor's expertise,
Right.
but it's about augmenting it, giving them more information so they can make the best decisions for their patients.
I love that.
Right.
It's like making doctors even better at what they do,
Exactly.
which then obviously benefits everyone.
Everyone wins.
Okay.
So that's the first part of that threefold role.
Got it.
Then there's supervising care plans.
Okay. How does AI play into that?
Well, here's where things get really interesting, because it speaks to this evolving role of the doctor, right?
Okay.
It's not enough to just, like, understand the science of medicine anymore.
Okay.
Doctors also have to become, like, AI literate.
AI literate. What does that even mean?
So it means they need to understand how AI works,
Right.
how it's being used in healthcare,
Okay.
and, most importantly, how to critically evaluate its outputs.
Right.
Because as amazing as AI is,
Yes.
it's not infallible.
Right. Of course.
Right.
Yeah.
So doctors need to be able to spot any potential biases,
Okay.
inaccuracies,
Right.
or, just plain wrong answers coming from AI.
Right. They can't just blindly be like, oh, the computer said it, so it must be true.
Exactly.
Right.
So it's about finding that balance
Right.
between, like, leveraging the power of AI and maintaining, like, that human oversight.
Yeah. So it's not just about like, okay, well, the AI said this, so I'm going to do it. It's about, okay, well, why did the AI say this? Let me do my own research.
Exactly.
Right.
Yes.
It's about using your brain still.
Yes. Use your judgment.
Yes.
And remember that, like, ultimately, behind all this technology are real people's lives.
It's true. It's a human life.
Right.
This isn't just like a theoretical experiment.
Exactly. And this need for AI literacy goes beyond just practicing clinicians.
Okay.
So the chapter talks about how, like, medical schools need to adapt their curriculum
Oh, interesting.
to train new doctors
Right.
to work alongside AI.
Oh, that's so interesting.
It's like, forget learning how to use a stethoscope.
Right.
Now you need to learn how to program one.
Right.
Well, maybe not program it, but understand how to interact with it,
Right. Exactly. And
interpret its outputs.
okay, that makes sense.
So we've talked about, applying medical knowledge, supervising care plans. The last piece of this puzzle is medical education and research.
Right.
So this is an area where AI is already having a huge impact.
Okay.
Because imagine, like, medical students practicing their diagnostic skills, right?
Right.
But with these, like, AI-powered simulated patients.
Wait, so instead of those like actors who pretend to be patients,
Right.
you have like AI programs that can like mimic real world scenarios.
Exactly. The chapter mentions this platform called Geeky Medics
Okay.
that's already doing this. So they've created these, like, AI-generated simulated patients
Oh, wow.
the medical students can, like, talk to.
Wow.
And the AI will actually assess their performance and give them feedback,
That's amazing.
which is incredible.
That's like next level learning.
Next level.
Yeah.
And beyond just, like, med school, AI is also transforming research.
Okay.
Imagine being able to analyze these massive data sets from, like, clinical trials
Yeah.
to find patterns and insights that would take human researchers like years to figure out.
It's like having an army of research assistants working 24/7.
Yes.
Amazing.
And that brings us to how AI is impacting specific medical specialties.
Okay.
We've talked about it generally,
Right.
but this chapter does a really good job of diving into how fields like radiology, oncology, and cardiology are already being like transformed.
Okay, let's get specific. What's
Oh.
going on in radiology?
So radiology is obviously like a very visual field.
Right. Sure.
Doctors spend a lot of time looking at images like X-rays, MRIs, looking for abnormalities.
Right.
And it turns out AI is really good at that visual pattern recognition.
Oh.
So the AI is like this second set of eyes
Right.
for the radiologist,
Right.
helping them to spot things they might miss.
That's amazing.
So the chapter mentions this study where an AI system was able to detect tiny fractures on X-rays that human radiologists had missed.
Wow.
And that's, that could be the difference.
You see,
Between someone getting the treatment they need and their injury getting worse.
exactly.
So it's really, really important.
Yeah, and again, it's not about like replacing the radiologist. It's about making them even better at what they do.
It's a tool.
Right, which ultimately means better treatment for the patient.
Better outcomes, yeah.
That makes me think about oncology because I've heard a lot about AI being used in cancer treatment.
Yeah, it's a really hot area.
Oh.
And for good reason, because this is where things get really exciting.
Okay.
Because AI is being used to develop these like personalized drug and cell therapies.
Okay.
So we're talking about tailoring treatments to a patient's unique genetic makeup
Oh, wow. Okay.
and their tumor characteristics.
It's like taking personalized medicine to a whole other level.
It really is.
Wow.
And it has the potential to revolutionize cancer treatment,
Right.
but it also raises some really like thorny, ethical, and regulatory questions.
Okay, like what? Give me an example.
Well, one of the big ones is data privacy,
Right, of course.
because to develop these treatments, AI needs access to tons of patient data.
Right.
We're talking genetic information,
Yeah.
medical histories, lifestyle factors.
Right.
So the question is, like, who owns that data?
Right. Right.
How's it protected?
Yeah.
Who gets to see it?
Right. Those are big questions.
Big, important questions. And the chapter talks about how, organizations like the Royal Australian and New Zealand College of Radiologists, or RANZCR,
Okay.
they're already, like, grappling with these questions,
Yeah.
trying to establish, like, ethical guidelines for
Yeah.
using AI.
Which is important because you don't want this amazing technology being used in a way that violates people's privacy
Exactly.
or like excludes them from getting life-saving treatment
Good.
because they don't, want to share their data, which I get.
Of course. And the chapter stresses how important it is to have these conversations now
Right.
before AI becomes, like, even more ingrained in healthcare.
Yeah, we're still in the early stages, so we can
Yeah.
kind of like course correct if we need to.
Exactly. Exactly. You want to make sure it's used responsibly.
Responsibly and ethically.
Yes.
Right.
100%.
Okay, so we've talked about radiology, oncology.
Mm-hmm.
What other like medical fields are being impacted?
Well, the chapter also talks about cardiology,
Oh, okay.
which is another field where AI is making a big splash.
Okay, like what? Is it diagnosing heart conditions now or?
In a way, yes. So AI is being used to develop tools for cardiac imaging.
Okay.
So helping cardiologists to analyze things like echocardiograms,
Okay.
EKGs, and other tests to kind of identify abnormalities and assess heart function.
So again, it's like having this second set of eyes.
Right.
But it's a superpowered cardiologist looking at your heart.
Exactly.
That's amazing.
It's really incredible. And you know what I find really fascinating is the chapter stresses the importance of like standardized reporting
Okay.
when it comes to these AI tools.
Yeah.
Because if everyone's using different methods and interpreting results differently,
Yeah.
it becomes really difficult to like compare findings and make sure these tools are being used effectively.
It's like everyone's speaking a different language.
Yes, exactly.
Right? Or you're like trying to build a house and everyone's using different measurements.
Yes, exactly. Exactly.
Okay, it's just not going to work.
It's a recipe for disaster.
Right.
So standardization is key.
Got it. Okay. So what other medical frontiers are being explored with AI?
Well, the chapter also mentions emergency medicine, which is really interesting because, in the ER, every second counts.
Absolutely, yeah.
Right. So imagine AI being used to analyze patient data in real time
Wow. Okay.
to identify those who are the highest risk of, their condition deteriorating,
Right.
and then alerting doctors so they can intervene sooner.
It's almost like a triage, but like on like hyper speed.
Yes, exactly.
I
And that can be the difference, again, between,
Yeah. Life or death.
life or death.
Right, which is intense.
Exactly. And the chapter also talks about how AI can be used for things like predictive modeling in emergency medicine.
Predictive modeling. What's that?
So basically, it's using AI to analyze patient data and spot patterns
Okay.
that might suggest a higher risk of, like, developing certain conditions down the road.
Okay, so it's like, let's say you go to the ER.
Yeah.
You've got like a really bad flu.
Yeah.
And the AI is like, based on your medical history and all these other factors, you might be at risk of developing pneumonia.
Right.
Right. And then the doctors can be like, okay, well, let's watch this really closely or, whatever they need to do.
Exactly. It's all about being proactive
Right.
rather than reactive.
Right. Which makes a lot of sense for like an emergency medicine setting
Exactly.
where you're often dealing with people on like the worst day of their lives, essentially.
Yeah, absolutely.
So really intense situations.
And speaking of cutting-edge technologies,
Yeah.
this chapter also touches on another area that's starting to, like, intersect with AI in healthcare,
Okay.
which is blockchain.
Okay, I'll be honest. Blockchain is one of those things that, like, I feel like I hear everywhere, but I couldn't really tell you what it is.
It's one of those buzzwords
It is a little bit.
that gets thrown around a lot.
Yeah, it's like AI or metaverse.
Right, exactly.
And, like, I don't really know what it is.
Right.
But it sounds important.
It is
And
important.
I probably should know more about it.
It is. It is.
But it has something to do with, like, cryptocurrency, right?
It does. So cryptocurrencies like Bitcoin are built on blockchain,
Right.
but blockchain is way broader than that.
Okay.
In the simplest terms, you can think of blockchain as like a super secure and transparent way
Yeah.
to store and share data. Okay, break it down for me like I'm 5.
Like you're 5, okay? Imagine, like, a digital ledger or a record book.
Okay.
That's not kept in one central location,
Right.
but instead it's distributed across a network of computers.
Okay.
So that's essentially what a blockchain is. So instead of having like one single file that could be like hacked or corrupted or whatever,
Right.
it's like spread out.
It's spread out. It's encrypted.
It's way more secure.
Way more secure.
Okay, that makes sense.
And every transaction on the blockchain is recorded and time-stamped.
Okay.
So it's also incredibly transparent.
Interesting.
This is huge.
Okay, so how does that apply to healthcare?
So potentially, we're
Mhm.
talking about storing, patient medical records,
Right.
insurance information,
Okay.
even clinical trial data.
Wow.
All of that could be stored on a blockchain,
Securely and transparently.
securely and transparently.
So patients would theoretically have more control over who has access to their data.
Right.
Right.
Yeah.
It's like patient ownership, which I feel like is something that a lot of people are, yes, that sounds great.
Exactly. Exactly.
Yeah, right.
And the chapter even talks about how you can combine blockchain with AI
Oh, wow. Okay.
to enhance things like clinical trials.
Okay.
So making it easier to, like, track data,
Okay.
verify the integrity of the results,
Right.
and get new treatments to patients faster.
Okay, so it's like two super-powered technologies joining forces to, like, change the world.
Exactly.
Like, that's a lot.
It's a lot to wrap your head around.
Yeah, it is. But that's what's so cool about this chapter. It's like
It's mind-blowing.
it takes these really complex, like, heady concepts
Yeah.
and makes them feel really tangible and relevant.
Yes.
Speaking of which,
Okay.
before we wrap up, I wanted to touch on one more thing the chapter talks about. Okay.
Which is how AI is impacting dermatology,
Dermatology.
which, you might not think that's like the most, like, high-tech field, but
You might not, but it actually makes perfect sense.
right.
Because think about what dermatology is.
Okay.
It's visual.
It's a very visual.
You're looking at the skin.
Totally.
You're analyzing images. And what have we been saying AI is really good at?
Right. Pattern recognition, analyzing images.
Analyzing images.
Okay.
So using AI to diagnose skin conditions is like, it's kind of a no-brainer.
Okay.
So the AI is basically acting as like this super-powered dermatology resident,
Right. Got it. Okay.
helping to identify skin cancers, rashes, all these other conditions.
That's incredible. And it makes me wonder if, like, one day we'll all just be going to the dermatologist virtually.
Just uploading pictures of our skin and being like, what is this?
It's very possible.
Right.
And teledermatology is an area where AI is already making a big difference.
Teledermatology, so you're just like basically having a virtual appointment with a dermatologist.
Yes, exactly.
Right.
So AI can play a big role in making that even more effective.
Okay.
For instance, you can have AI-powered chatbots
Right.
that triage patients.
Okay.
So they're directed to, like, the right level of care.
Oh, that makes sense.
Right.
Because not every rash needs, like, a full-blown
Exactly.
dermatologist appointment.
Sometimes you just need a little reassurance.
Yes, exactly. Just like, am I going to be
Listen,
okay?
exactly.
Yeah.
And the chapter highlights how, like, AI-powered teledermatology
Yeah.
can address disparities in access to care.
Oh, it's huge.
Right.
Yeah.
Because in rural areas
Right.
where you might not have a lot of dermatologists,
Yeah, exactly.
teledermatology can provide this vital link to specialized care.
That's amazing.
Right.
Wow. Okay, so we've covered, like, a lot of ground here.
We've covered a lot.
From, like, the nitty-gritty of how AI works to its potential impact on, like, diagnosing diseases,
Yeah.
revolutionizing medical training.
Yes.
I mean, it's clear that AI is going to transform healthcare as we know it.
There's no doubt about it.
It's just a matter of, like, how we manage it, right?
Exactly. And as with any powerful technology,
Right.
there are some, like, ethical considerations that we need to be really mindful
Of
of.
course. And this chapter from Beyond the Hype does not shy away from those at all.
No, not at all.
It really dives into how we can make sure that AI is used responsibly, ethically.
Yes.
Which I think is something we all care about.
100%.
Right.
Yeah. And the chapter actually lays out some really concrete recommendations
Okay.
for what it calls responsible AI integration.
I like that.
And it starts with involving clinicians
Okay.
in the entire process,
Makes sense.
from design
Oh.
to implementation.
Yeah, you can't just, like, spring it on them.
Exactly.
Like, here's this new tool.
Right.
Figure it out.
It's like asking a chef to use a brand new oven
Right.
they've never even seen before.
Right. They had no input. They
Yeah.
didn't get to, like, design the kitchen.
Exactly.
Right.
Exactly.
Okay, so involving clinicians from the get-go.
Yes, and then beyond that, training, right? You can't just hand someone, even a doctor, these powerful AI tools and expect them to know what to do.
Right, because the tools are only as good as the people using them.
Exactly.
Right, if you don't know how to use it.
Garbage in, garbage out.
Exactly.
Right. Okay, so training, what else?
Transparency is a big one.
Okay.
The idea is that these AI systems shouldn't be a black box.
Right.
Like, patients and clinicians should be able to understand, at least at a high level, how decisions are being made.
So if an AI is like, hey, this person might have this, you should be able to be like, okay, well, why do you think that?
Yes, exactly.
What data did you look at to come to that conclusion?
Exactly. It's not just, like, taking it on faith.
Right, exactly.
Right.
It's about understanding.
Yes. And I think ultimately...
It's about remembering that, like, behind all of this amazing technology are real people.
It's true.
With real lives.
Yeah, it's easy to get, like, really excited about all the bells and whistles.
All right, the gadgets.
Right.
Yeah.
And kind of forget about that human element.
The human element, and that's why I think this chapter's emphasis on ethics
Yes.
and patient well-being is so important.
It's about, like, using this technology to make healthcare more human,
Yes.
not less human.
100%.
Right.
Yeah.
So where do we go from here? What's the takeaway?
The takeaway is that the future of AI in healthcare isn't, like, this predetermined thing,
Right.
It's something that we are all creating
Right.
through the choices that we're making today.
Oh, that's a good point.
So we need to be asking questions. We need to demand transparency.
Yes.
And as a society, I think we need to have these open and honest conversations
Right.
about, like, the ethical implications of all of this and make sure that it's being used in a way that benefits everyone.
Absolutely. And I think this chapter does such a good job of laying the groundwork for those conversations.
It does. It's a great starting point.
It's really thought-provoking and hopeful.
Yes.
It paints a picture of a future where AI is actually making things better for everybody.
Exactly.
Which is really exciting.
Yes.
Well said.
Thank you.
And on that note, I think we'll wrap up this deep dive
I agree.
into the fascinating world of AI in healthcare.
It's a wild world out there.
It is. But hopefully you found this conversation insightful, engaging.
Maybe a little bit inspiring.
A little bit inspiring.
Yeah. Yeah. I like that.
Until next time.
Stay curious.
Stay curious.
And keep asking questions.
Keep asking those questions.
Love it, Ari. Thanks for chatting with me.
Oh, it's a pleasure. Thanks for having me.